So I want to start by introducing you to this guy. Does anyone recognise this guy? Yeah, few people, good. So for those who are not sure, this is Derrick Rose. He plays for the Chicago Bulls in the NBA. And he had an ACL rupture in the playoffs a couple of years ago. Anyone recognise this girl? Yes. Mario, good job on the social media. That's really good, mate. Your branding's working. Excellent. So for the purposes of patient confidentiality, I'm going to refer to this girl as Sarah. Okay. Now, Sarah is actually, as it happens, a physiotherapy student. She's studying full-time, but she's also super keen on football, soccer for the non-Europeans in the audience. And I think as clinicians, it's actually really useful when we're exploring the data to think of it in terms of these cases and how can we use the data to apply, how can we apply the data to our clinical practice? You know, what do we take from it? And so I'm going to use these cases today. They'll come back a couple of times to help us kind of explore the data a bit more. I'll take my research hat off and put my clinician hat on, which is a lot more fun. So by the end of today's session, you will know the return to play rates after ACL reconstruction and also after a non-reconstructed ACL injury. We'll try and answer the question, does Sarah need to have an ACL reconstruction? We'll also look at what influences return to play after an ACL reconstruction, what factors might influence the return to play, and how you might assess when an athlete is ready to go back to sport after their ACL injury. So let's have a show of hands. How many people get back to play after an ACL reconstruction? What do you reckon? So hands up if you reckon it's above 90% or 90% and more. Hands up. No takers. Oh, one taker. Excellent. Two takers. Brilliant. Oh no, a couple more. Good, good. Okay. What about, so hands up 70% and more. Okay, now we're getting somewhere. It's a bit better. There's still a few pessimistic ones around here. What, are you guys doing bad physio or something? So when we put the data together, what we actually find is that you guys saying about 70%, you're pretty much there. You've been doing your reading, haven't you? You've been sorting up for this. So we find that 2 out of every 3 athletes get back to their pre-injury level sport at some time after their surgery. But only half of them get back to competitive sport. It's pretty low, huh? Especially when you think that for most athletes, the reason that they choose to have surgery is because they want to get back to sport. There's a lot of them that don't. What about after a revision ACL reconstruction? What do you think? Does it matter if you've had surgery before? What do you find in your clinical practice? Does it matter if they've had surgery before? Yeah? Yeah, it does. So it's only about half of people who've had a revision ACL reconstruction who get back to their pre-injury level of sport. Here's another question for you. How long does it take people to get back to play? Okay. So this was something I was really interested in my PhD. And what we did was to take a group of over 500 athletes and we asked them at 1 year after their surgery, have you got back to your pre-injury level? And really surprisingly, we were pretty shocked by this. Only 1 out of every 3 of them said, yep, they'd returned to their pre-injury level at 1 year. So we thought, okay, not what we expected. How are we gonna explore this more? Maybe these guys, they just need a little bit of extra time. Maybe our expectations for the return to play are a bit too high. So like any good researchers, we asked another question. We surveyed these people at an average of 3 years after their reconstruction. And what we found was that 2 out of every 3 of them said that they had played their pre-injury level at some time after surgery. But interestingly, when we asked people, are you still playing sport? Only 1 out of every 3 of these athletes said that they were. So I wonder if that fits in with your clinical experience. Is this what you tend to see? So I threw a whole lot of numbers at you just then, and I think it might be useful to just summarise it, and I find it useful to think about it in terms of this graph. So when we're looking at return to play after an ACL reconstruction, we get this increase in the return to play rate, and it peaks at around about the 2-year mark. So there's a lot of people who are still returning after 1 year. But then we get this drop off again. And we don't know if people stop playing sport because they retire, or maybe they change sports. We're not sure about that. And the other thing is, these dots represent what we don't know. We don't know the long-term sports participation after an ACL reconstruction, ACL injury. So I think thinking about this, it's useful to think about it in terms of thirds. So you can expect 1 out of every 3 of your athletes to be back playing their pre-injury level at 1 year after surgery. At some time after an ACL reconstruction, you can expect 2 out of 3 of your athletes will get back. But there's only 1 out of every 3 of them who are still playing, who are playing when you look at any time point. Now, I'm not sure about you, but I was actually pretty disappointed by these numbers. I thought they'd be higher. Let's move on now, and let's have a think about Sarah and try and answer this question. Does she need to have an ACL reconstruction? Okay. But first, I want to just go back and bring Derek back in here. So we know Derek plays professional sport. He plays a really high demanding sport. He plays basketball. So I think most of us would probably agree that the majority of these athletes do need to have an ACL reconstruction. Okay? But the question is, Sarah comes into your clinic and she's not a professional athlete, but she really loves her football. And she plays really hard. She plays at a pretty high competitive level. She's also got a life outside of sport. Does she need to have an ACL reconstruction? She comes in with her MRI and says, look, I'm absolutely devastated. I've got this ACL injury and all my mates are telling me you've got to have surgery. You're never going to get back if you don't have surgery. So let's have a show of hands. If Sarah comes to you in your clinics and says, what should I do? Should I have an ACL reconstruction? Who says yes? Put up your hand if you're going to tell Sarah, yes, she needs to have surgery. Okay, yeah. Yeah, so there's quite a few of us who say yes. Who says no? Who would say no to Sarah? Okay, so who's not sure? Who needs more information? Okay, so I reckon this is a really good question. You know, it's a hard question. So let's see if there's some data that can help us answer this question. And I want to talk about this really important study. And some of you might be familiar with it. And the reason I use it here is because it's got some really important information in it that can help us answer this question. What they did in this study was to take 122 young athletes. They were within 4 weeks, start again, Claire, 4 weeks of their ACL injury. And the important thing here is that they were all really active. So the majority of them played competitive sports at a pretty high level, and these were competitive pivoting sports. So sports like football or soccer, basketball, handball. They were in Sweden, so they loved their handball. And the reason that I point this out is that these are the typical patients that we see, and these are also the patients who, if they see the surgeon's likely to suggest or recommend to them to have surgery. So what they did in the study was to randomly select half of the patients to have immediate surgery. And the other half of them went off and had rehabilitation, and with the option to have a late reconstruction. So if they needed to have surgery later on, they got it, but they started off all having rehabilitation. And then they followed them for 5 years. And this is the most complicated graph that I'm going to show you all talk. So if you can manage this, we're laughing. Sorry, let's go back. So what this graph shows is the primary outcome for this study. And the primary outcome they were interested in was self-reported knee function, measured with the CUS. And so the CUS is a typical ACL measure, and it's also used in osteoarthritis. The key thing to take from this is here. So at 2 years, everybody rated their knee function exactly the same. So the people who never had surgery, they're the green, these tealy coloured circles. The people who had early or immediate surgery, these are these guys, the open circles. And the yellow triangles are the ones who had the late reconstruction. Okay? But everyone said they rated their knee function the same at 2 years. And this is really important because we're going to look at the return to play rates. Okay? So, at 2 years, about 40% of the people who didn't have surgery had returned to their pre-injury level. 44% of the people who had an immediate reconstruction had also returned at 2 years. And 30% of the people who had the early rehabilitation and then had a reconstruction later on. And there is no statistical difference here. No difference. The return to play rates are similar at 2 years, regardless of what kind of treatment people had. But what about 3 years later? How are these guys going at 5 years? And at 5 years, look at that, there's absolutely no difference. Those lines are overlying each other, and you can see here that regardless of the type of treatment people had, only 1 out of every 5 of them were playing their pre-injury level sport at 5 years. 1 out of every 5. I reckon that's a bit disappointing, actually. But the point is, it didn't matter what kind of treatment people had. The other interesting thing, I think, is to look at pivoting sports, returning to pivoting sports, because these are the sports that we're concerned about. It's the athletes like Derek who are playing basketball, high-demanding pivoting sports that we think they probably do need to have surgery. And in this really nice study from Norway, they compared people who didn't have surgery to people who had reconstruction. And for those who the rate of return to what they called level 1 pivoting sports, so contact pivoting sports, really high knee demanding sports, the return to play rate was similar, and there was no statistical difference. So people got back to football, rugby, basketball in similar numbers, regardless of whether they had surgery or not. They also looked at what they called level 2 pivoting sports, so less knee demand, but still pretty demanding sports these are. And again, there was no statistical difference. So I think the key thing here is that return to play rates are similar, irrespective of whether someone has surgery or whether they don't. So if the only reason that we're referring an athlete to a surgeon for an opinion about surgery, if the only reason is because that athlete says, I want to go back to sport or I want to go back to pivoting sport, we're really kidding ourselves. Let's move on now to the next section. So let's talk a little bit about what some of the factors might be that influence returning to play. Now, there's a whole lot of clinical experience in the room here, and I'm sure that you've got some good ideas about what these factors might be. So let's try and answer this question. Why don't some of these athletes get back to sport? I'm sure you've seen them. You've seen some of these athletes come in through your clinic. And some of them, they fly through rehab, they get back to sport, no worries, not a drama at all. And there's others who come in and they really, really struggle. Why is that? So the knee-jerk reaction might be to think about physical function. So it seems reasonable, doesn't it? That if you've got poor knee function, if you've had poor surgery or you've had poor rehabilitation, you haven't been diligent, you've been slack, school's been busy, work's been busy, it seems reasonable to think that you might struggle to get back to sport. But when we put the data together, what we find is that people do well, pretty well based on our standard clinical measures. So on average, they can hop at least 85% as far on their operated leg compared to their non-operated one. They regain their quadriceps and hamstrings muscle strength to within 10% of the non-operated side. And they've got stable knees. So there's a whole lot of athletes out there with apparently good knee function based on our standard clinical assessments, and they don't return to play. Now, I'm sure that you've probably seen some of this. Maybe you've noticed that through the clinic, it's the young athletes that seem to get back more quickly or find it easier to get back. Maybe you've noticed that the men get back faster, or it's easier for the men to get back to sport. More of them get back than the women that you're treating. And if you're seeing elite athletes, you probably notice that more of them get back than the non-elite athletes. But is there something that we're missing here? Is there something that you've seen in your clinical practice that we haven't talked about? Something that you find really important? Yeah, psychology, nice one. Thank you. So I can see it in, you yelled it out, but I can see it in other people's faces. It's the mental aspect. Some of these athletes, they find it really challenging. Have you thought about fear of re-injury? I'm sure you've probably seen athletes who are really worried about getting a new injury. And for the ones who don't return to play, it's the number one reason that they give. They're worried about a new injury. And so the psychological factors are getting a lot more research attention. And what we're finding is that there are big effects. The psychological response or the psychological factors have a big influence on whether someone gets back to sport. So the people who are more psychologically ready to return to play, those athletes are much more likely to return to their pre-injury level. We just talked about fear of re-injury. And again, the ones who have got low fear of re-injury are much, much more likely to get back to their pre-injury level of sport. And again, the effect is pretty decent. And just to illustrate that, let's look at the effect of one of our common clinical tests. So we might use a hop test to help us decide when these athletes are ready to return to play. But when we look at the data for hop tests, we find it's actually a really small effect. That corresponds to 3% difference in hopping performance between people who return to play and those who don't. Only 3%. And in all of these people, they're hopping at least 90% of their non-operated side. So can you see these psychological factors, the importance of them? I'm sure you've seen this in your clinical practice. And for those who are maybe not seeing as many ACLs, I would bet that you probably noticed this with other injuries, other serious injuries. So the key message here is that when it comes to returning to play after an ACL injury, the mind, it really matters. So athletes who are more psychologically ready to return to play, they're more likely to get back. The athletes with more positive psychological responses, they get back faster. And they also rate their performance as being more, rate their return to play as being more successful. So let's bring Derek back for a minute here. And I think Derek really nicely illustrates this challenge, this mental challenge. So we know that Derek had his ACL rupture in the NBA playoffs. He had surgery really quickly. And then he had this rehabilitation time. He was cleared to return to play 10 or 11 months later. All going really well. Great stuff. But look at this. There's 7 months in here between clearance to return to play and getting back to his first regular season game. Now, Derek copped a lot of flack from the media for this. They were saying, oh, come on, mate, you're ready to go. Like, what are you waiting for? You know, your physical function's great. Doctor's happy. Everybody's happy. What's wrong with you? Get back. Come on. And he openly talked in the media about his not being mentally ready and that he wasn't going to go back until he was mentally ready to return to play. So if an athlete like Derek, you know, he's our gold standard. He's performing at the very top level. If someone of his calibre is having challenges returning to play, what hope have the rest of our athletes got? So let's come back to Sarah. What's Sarah up to now? Sarah actually didn't have surgery. She took a while to get back to play. It probably took her about a year. She was pretty diligent with her rehab, but you know, university exams got in the way. She went on some clinical placements, so it took her a little while. And she also found that the return to play transition was challenging, was a bit scary. But for Sarah, using that fear was really motivating. So she first came back, she realised, oh, actually, this is not so bad. My knee's not so bad. And that gave her confidence to continue her return to play. And she's actually been playing for 9 years now and still plays football. Okay, let's move on to the last section. How do we know when these athletes are ready to go back? How are we going to assess this? Now, Håvard Moxnes is going to do an excellent presentation in the next session looking at return to play criteria and clinical guidelines for return to play. So I'm not even going to go there. I'm not stealing his thunder and talking about physiological measures. What I want to talk about is, and share with you, is how do we assess the mental side of it? How do we know when these athletes are psychologically ready to go back? Can we know this? And this is something that I found particularly enlightening in my PhD work. Thanks for that laugh. That's my favourite cartoon. So what we did in this study was to give athletes a questionnaire that asked them about their psychological readiness to return to play. And what was interesting was, and I'll talk about that questionnaire in a minute, but what was interesting and what I'd like you to take from this slide is that the ones who scored at least 56 points on this scale, they were up to 8 times more likely to get back to their pre-injury level of sport. And this is the scale that we used. So it was developed by my colleagues in Melbourne, and it's 12 questions, which I think clinically is really good because it's short. You know, athletes hate filling in extra questionnaires. They hate filling in the patient information form when they first come to see you. And the 3 areas that this scale addresses are confidence, emotions, and assessment of risks associated with playing sport. So the types of questions that it asks are things about the athlete's confidence in their performance, how they're feeling about getting back to play, and how they're assessing the risks associated with playing sport. And I think quite usefully for us as clinicians, this is also available as a free iPhone, iPad app. And full disclosure, I have absolutely no commercial interest in this app. I'm definitely not paid by them. I'm merely alerting you to the fact that there is something out there that you might find useful in your clinical practice. Okay, let's wrap this up. So we've seen that not all athletes return to play after an ACL injury, whether it's after surgery or non-surgical treatment. And I think a useful way, as we talked about earlier, to remember these return to play rates is the rule of thirds. So 1/3 of them are back playing by 1 year. You can expect 2/3 of them to be playing their pre-injury level at some time after their surgery, but only 1 out of every 3 of them will be playing at any one point in time. And if we're thinking about timing of return to play, that ties us nicely into Derek. So it took Derek 18 months between his ACL injury and returning to play. And he's our very top athlete. So I think it really suggests that we need to maybe think about our expectations for return to play. Do we need to change them? Are we being realistic with these athletes, or do they need a bit of extra time to return to play? The next thing is that return to play rates are similar, irrespective of whether someone has surgery or they don't. And we saw that in this graph, these 2 time points, there was no difference between the people who had surgery and those who didn't. But we also saw it with Derek and Sarah, didn't we? So both of them pivoting sports, you know, both really keen athletes. One had surgery, one didn't, and they both got back to play. Now, we can certainly talk about other cases, and I'm sure that you have probably got lots of Sarahs in your clinics, and some of those Sarahs do need to have surgery. I'm not saying that, you know, we just tell the surgeons to get lost. There are athletes who need to have surgery, but the key is that it's not everyone. The Frobel study showed that about 60% of athletes did need to have surgery, but there's a whole lot of them who don't. And finally, again, as we saw with Derek really clearly, the mind really does matter when it comes to returning to play after an ACL injury. And the ACL RSI questionnaire is something that you might consider using in your clinical practice. So I hope I've been able to give you some food for thought when we're talking about returning to play an ACL injury, and I really, really look forward to speaking more with you in the coffee breaks and over lunch and hearing your experiences and your thoughts on this. Thanks very much.